Thank you, Brenna, for joining us this morning. I think this is a very relevant topic for a lot of people over the course of their bird ownership, and especially right now, which is why we wanted to get this one scheduled. So, thank you so much for joining us again. We always love to have you. And then, Julie, would you like to say good morning and hello to
I would.
everybody?
I want to especially thank Dr. Brenna for being so available to us to share this really important topical information about our birds. Um, it's relevant to so many different species. We really, really appreciate this. And also, I want to thank Kira, who is acting as our moderator, for doing such a wonderful job putting these webinars together. And to you, everybody who's listening in, for your time that you're investing to make your birds' worlds better and safer. And we encourage you to share these videos. People can log on for free. They'll be on our YouTube channel and they're there. And it's just a wonderful opportunity to sort of spread the gospel about female reproductive disease in parrots. And over 31 years, we've had a lot of experience. And as the founder, we would not be able to care appropriately for all these birds who have needed us throughout the years if it weren't for our team who has done an exceptional job in learning how to identify, clean, treat, and hopefully prevent prolapsing opportunities and reproductive disease for our flock. So I'm excited to learn today, and thanks everyone for joining.
Wonderful. And then little housekeeping notes. Please put all of your questions and comments that you have for Dr. Fitz in the Q&A is going to be the best spot for me to see all of those. And then we will mostly be answering all of our questions at the end of the presentation. If you have any questions about a specific slide or specific information, if you can put the slide information, like the slide number in your question, that'll be really helpful for us to then go back and be able to see that. But until then, we'll go ahead and get started.
Okay, very good. It's my pleasure to be here today. I cannot say enough good things about the Gabriel Foundation and the great work that the team does. And I'm really happy to be invited to do this webinar today. So I'm going to work on sharing my screen here and make sure that's going to work for us. Okay, so I'm going to start the presentation here and back up a couple of steps. And Kira, do you see that title slide filling the screen?
Yes, I do.
Okay, wonderful. Okay, so we'll go ahead and get started. We have a lot of things to talk about. Um, so yeah, we're going to be covering female reproductive disease in companion birds. So we're mainly talking about parrots, but certainly there are other kinds of birds that are also great companions and pets to us, including chickens and pigeons. So, you know, a lot of different groups. But we'll mostly be focused on parrots. And we're really not going to be talking about the guys much today. We're basically going to be focusing on our girls. So the topics I'd like to cover today, I want to review and teach you guys about female reproductive tract anatomy and physiology. It's important to understand that as a basis to understand the kind of disease that they get and also what kind of treatment is necessary. We're going to talk about the disease conditions that are most commonly seen in female birds and the signs and symptoms of those diseases, which will help you, keep an eye out for such things at home with your birds. Diagnosis, so what diagnostic tools we have available to us to figure out what's going on, treatment options, and also at the end, some husbandry considerations, diet and husbandry considerations that are relevant to reproductive tract disease and reproductive activity. So first, we're going to talk about female reproductive anatomy. So what's really interesting is that in the embryo, both the left and right ovary and oviduct. You can consider the oviduct kind of like the uterus. It's a little bit more complex than that, but we'll go into it. But the embryo begins to develop both left and right-sided, kind of like you think of in a mammal. So like us people, we have two ovaries, we have two oviducts, which are the fallopian tubes, which come down to the uterus, which is kind of midline in the center. And these guys start developing the same way, but in most individuals, during that development, the right side regresses and does not fully develop, and then the left side goes on to fully develop. So, in most cases, in most individuals, the reproductive tract is going to be on the left side of the bird. One ovary, one oviduct. So showing you, and Kira, can you see my cursor here? So I want to make sure you guys can see that. Okay, wonderful. Okay. So the ovary looks like a mass of the small follicles here. I like to describe it as a cluster of grapes, but with the grapes kind of being different sizes. So a lot of these are little proto follicles that haven't really begun to develop or mature yet. And then they start to mature and they get bigger and bigger until they are ready to be ovulated. And that is described. The biggest one that is first in line to be ovulated is called the F1 follicle. And then from there, F2, F3, F4, and F5. But yeah, the follicle, by the way, also known as the ovum, is and becomes the yolk of the egg. So situated kind of right adjacent to or next to the ovary is the opening of the oviduct. And I like to describe the oviduct as a big, long, convoluted tube sock, and it's all folded on itself. The way it's shown here, where it's kind of stretched out, is actually a little bit misleading because in the bird, it's all bunched together and folded on itself. And there are these connections that anchor it within the body. And the opening of the oviduct, the very first segment, is called the infundibulum. And it's kind of like a catcher's mitt, if you will. It is poised and positioned to receive the yolk or the ovum as it ovulates off of the ovary. Then, once that's entered the oviduct, it goes through essentially an assembly line and gets packaged into an egg, one component at a time, until it gets down to the very end. And then the oviduct interfaces or enters into the cloaca. And just to let everyone know, the cloaca is essentially like a bladder, where here's the vent opening right here, and you go right inside the vent opening, and there's this chamber that most of the time holds on to the dropping before they're ready to push it out and pass it. But the cloaca, unlike our bladder, receives all of the systems. So you're seeing here a couple of things. This here and this here are the ureters coming from the kidneys, and those empty into the cloaca, and they deliver both urine and urates, which is the white part of the dropping. And then in the female, the oviduct comes in and it interfaces with the cloaca as well. In the male, it's the vas deferens coming down from the testicles that interface into the cloaca. And then, not really shown so much in here, but the colon comes down into the cloaca as well and delivers feces. So everything accumulates in here as far as the dropping and then is passed, but when they lay an egg, it comes all the way down to the very last segment of the oviduct right before it enters into the cloaca is properly called the vagina. It comes through that. It should briefly, transiently go into the cloaca before it is laid out through the vent. So that's the way things are supposed to work. The oviduct is divided into all of these different segments here, and each segment does different things. And so we're going to review that as well. This image also shows a vestigial right oviduct. That's important because it can produce problems in adult birds sometimes. Again, that whole right side starts to develop in the embryo, but doesn't go to completion and regresses. But what is left is kind of a little nubbin of what would have been the right oviduct. And that can become cystic. And that's one of the conditions we're going to talk about. So here is a picture of what this looks like in real life. Now, this is a chicken, so it's much larger than you would think about in like your cockatiel or so, but it's all organized basically the same way. The ovary has all these kind of small protofollicles that will eventually develop and become mature ova. These are the ova that are getting ready to ovulate, the largest one that's ready to go being the F1 follicle. And then you sort of have this slit-like opening of the infundibulum that the ovum pops off, ovulates, and goes into. And then it works its way through the different segments, which have different names, until it gets down to the so-called uterus. So the latter part of the oviduct is termed the uterus, and it's also termed the shell gland. And that's because that is the location where the shell, initially soft, becomes calcified. Then there's a short little stretch through the vagina to enter the cloaca and then out of the vent. So again, these are the different segments of the oviduct, and these are the different stages of egg production that is happening in these different segments. So again, it's kind of like an assembly line. It's the way I think of it. The ovum pops off, it enters the catcher's mitt of the infundibulum. There's these suspending little structures called chalaziae that get applied. And then as you're going through the magnum, the albumin, that's the white of the egg, begins to be formed around the yolk and these suspensory structures, the chalaziae. Then, as we're getting into the isthmus here, we've got more albumin and a soft shell or the shell membranes being put on. And then you enter the uterus or shell gland, and that's when the shell becomes calcified. Then you've got your short path through the vagina and then at the cloaca. Meanwhile, the colon's coming into the cloaca too, the ureters, which aren't shown here, and then a little vestigial nubbin of the right oviduct. So here is another image of the real thing. This time with the ovary kind of over here. Here's our catcher's mitt of the infundibulum. And let me pause here for a moment and point out that the oviduct, the opening there, is not directly attached to the ovary. And that's important because it is possible for a yolk to miss the target, to not enter the catcher's mitt for one reason or another. We don't always know why, and to fall loose within the abdominal cavity or properly the coelomic cavity. So I wanted to point that out because that's relevant to some of the conditions we see as well. So again, the different segments of the oviduct doing different things described over here of what's happening in each of those segments. Once it enters the uterus, not only is that the site of calcium deposition into the eggshell, but also the egg gets kind of plumped and gets with water coming into all of that, all the whites and albumin to make it its more normal full size. And then the shell becomes calcified. It then passes through the, little bit of a sphincter between the shell gland or uterus and the vagina, and that is the uterovaginal sphincter, and then coming into the cloaca. So the purposes or function of the vagina, it actually can store sperm, which is interesting. And it ultimately coordinates with the shell gland to expel the egg out through the cloaca and then the vent. So let's talk about a little bit of the physiology going on here and the hormonal influence, because this is relevant, highly relevant to reproductive activity and what the things that trigger it is what we need to understand, and also how, some of the methods we have to control it. So these are the things that are happening in the bird's brain. So changes in photoperiod, so talking about length of daylight, like right now, coming into spring, we have much longer days of daylight. That stimulates the hypothalamus in the brain through the optic nerve, so through their eyes, essentially. But even more interestingly is that there is a structure called the pineal body in the brain, and literally it picks up light or detects light through the skull, which is pretty wild. So photoperiod or length of daylight is one, but not all, of the stimuli that can turn on the hypothalamus in the brain. And then we have this cascade effect going on. So when the hypothalamus is stimulated, it results in production of a hormone called GnRH, which is gonadotropin releasing hormone, but we call it GnRH for short. GnRH talks to the pituitary gland. And the pituitary gland, in turn, starts producing more hormones that govern the development and maturity and ovulation of follicles. So getting going on egg production. The pituitary produces FSH, which is called follicle stimulating hormone. That stimulates the growth and development of kind of these protofollicles, which we call oogonia, and also the ovary. So it kind of turns on the ovary, if you will, and the ovary starts to produce estrogen and progesterone. In birds, we refer to estrogen more specifically as estradiol. Then, or I should say, the pituitary also produces a hormone called LH, or luteinizing hormone. That then induces ovulation and the release of that ovum into the catcher's mitt of the infantibulum. So collectively, we refer to this cascade as the HPG axis, hypothalamic, pituitary, adrenal, gonadal axis. The gonads being the ovary in the female and the testes in the male. So what kind of reproductive tract diseases do we see? One thing that's very common is chronic egg laying. We also see what is most commonly known as egg binding. I prefer to use the term delayed oviposition, and that means that there's been a longer than expected time frame for that egg to be laid. They're holding on to the egg and something's not going right. Also cloacal and oviductal prolapse. Julie mentioned prolapse, and in addition, and indeed, it's a very significant issue, and relates to other reproductive issues. Oviductal impaction. That means that the oviduct gets backed up or gets a bunch of buildup of egg debris, even multiple eggs like log jammed in there. The oviduct can tear and rupture open. And you can get infection within the oviduct, which is termed bacterial salpingitis, because the technical word for the oviduct is salpinx. That's kind of the Latin anatomical term. We see, unfortunately, neoplasia, that is cancer of the ovary and the oviduct. We can see a persistent right oviduct, which is usually cystic, and that's why I was mentioning that with the embryonic development. We get yolk coelomitis, probably more correctly called yolk peritonitis, where we have yolk that gets freely into the body cavity and causes a bunch of inflammation. We have ectopic eggs, which means eggs that get out of the oviduct somehow and are free within the body cavity. And we also see hernias from time to time. So what are some risk factors for reproductive disease? A really big one, which most of us are familiar with to some extent, is inappropriate reproductive stimulation or activity. Now, sexual behavior, of course, is normal behavior, but without meaning to, we can feed into reproductive stimulation and encourage reproductive activity. And those birds that are producing a lot of eggs are a lot more likely to have reproductive tract disease develop at some point. It's like kind of a ticking time bomb, if you will. Related behavioral problems as well. A lot of people describe that, they're screaming their heads off because they're hormonal, or they're biting because they're hormonal, or things like that. So certainly hormones, sex hormones can affect behavior. They're not usually the only factor, but they can. And so doing our due diligence to try to mitigate and moderate our birds' reproductive stimulation is important. And we're going to talk a lot more about that. Other risk factors are nutritional problems, obesity, and also husbandry deficits. And what I'm largely referring to there is that if there's not enough for the bird to do and to stay busy with and engage with, um, sometimes there's quite a hyper focus on sexual behavior because it's like that's kind of all I have to do. So redirecting our birds to different activities and keeping them busy with other life pursuits and not just reproduction is helpful. So talking about chronic egg laying or excessive egg laying are birds that are just cranking out eggs. And there's some species that we kind of recognize as being more prolific when it comes to egg production. Um, One of those, probably the poster child, being the cockatiel. But others can be like that as well, depending on the circumstances. But like I was saying, an overproducing hen is more likely to eventually develop reproductive pathology. So we want to try to strategically decrease egg production to proactively reduce risk. And we're going to be getting into a lot of details about that. And a big part of that is controlling or manipulating the HPG axis. We want to essentially disrupt it. We want to shut things down. We want a bird to the best of our ability, try to keep them reproductively quiescent or inactive. So ways that we do that here with the decreased photoperiods, so like decreasing hours of daylight, I have a question mark there because even though I know that photoperiod plays a role in reproductive stimulation and activity in our companion birds. Controlling hours of light, um, which you'll read about and hear about all the time, like they need to have 12 hours of darkness, sleep 12 hours, what have you, put them in a closet so there's no light whatsoever for 12 hours. I don't find it to be very effective or reliable in parrots. It is derived from poultry, uh, and they are kind of more reliably controlled by that. I think that there are many other factors in our companion birds that play a more powerful role in reproductive stimulation. And so I'm not a big proponent of controlling hours of daylight. I find that it can lead to a bird, feeling really isolated, and can cause stress and anxiety. So I'm not a big believer in that as being a very effective tool. Instead, things that seem to help a lot more are decreasing calorie intake and making lifestyle and husbandry changes, meaning an appropriate diet, but we don't want excess fat and calories. Um, we want to reduce our pair bond interaction with our birds and mitigate that. And we also want to make sure there's a lot of enrichment so that they have alternative focuses and activities. GnRH agonists are the group of drugs that include Lupron. So most of you have probably heard of Lupron. There's also an implant called deslorelin that acts in the same way, but is more of a slow release and lasts longer. And that is an artificial means, if you will, of suppressing the HPG axis and suppressing reproductive activity. And it does have its place. We will be expanding a little bit on these ways of suppressing the HPG axis as we go along. So egg binding and dystocia, there's actually a difference between those two terms. Egg binding, or like I prefer to say delayed oviposition, means that the egg is arrested in the oviduct. It isn't coming through, it's staying in there longer than normal. If a bird is laying a clutch of eggs, most parrots are going to lay an egg every 48 hours. So let's say they lay an egg and then a week later, they're still acting like they need to lay, but it's still in there. That's what we would refer to as delayed oviposition or egg binding. Dystocia means more like there's a physical blockage or the egg is producing a physical blockage. So it's in the end of the oviduct, but it is basically it can't come out. It's kind of physically, mechanically stuck there. And it's obstructing the cloaca, maybe making it hard for the bird to pass droppings. And it may even be prolapsed through the oviduct and cloacal opening. Um, so sometimes we'll see, let's say it is physically stuck within the uterus portion or the shell gland, and that portion prolapses inside out through the vent containing the egg. So that's like one scenario that is like that. This is just an X-ray showing a small bantam breed chicken, and you can see what the egg with the calcified shell looks like positioned down here toward the end of the bird, in a position that should be able to be laid. However, you can't look at an X-ray like this and know for a fact that it's all good. Know for a fact that there's no obstruction or dysfunction, or for that matter, that the egg is still in the oviduct. So you can have an X-ray like this, let's say that's been in there for 3 weeks and it isn't going anywhere, and I even look up in the cloaca and I don't see it crowning through the vaginal opening or anything like that. Then I might start questioning, is that egg free within the coelomic cavity? So what are some causes of egg binding and dystocia? Well, if the oviduct just isn't working properly, if all the systems just aren't working well, the problem may be that the egg is malformed, it's unusually large or misshapen, poor shell quality. It's harder for them to lay a soft-shelled egg that hasn't been calcified properly than a calcified eggshell. You may have masses in the way. You may have, that could be in the oviduct, it could be in the cloaca. Obesity can be a problem because fat takes up a lot of space within the coelomic cavity, and it surrounds and compresses and distorts the position of the oviduct. It can even push the infundibulum or the catcher's mitt away from the ovary, setting the stage for the ovum to miss the infundibulum and then splash free within the coelomic cavity. But basically, if there's underlying disease of the oviduct, basically if any of this passageway, the cloaca, et cetera, that the egg has to get through could result in that. And then there can be some metabolic problems related in part to nutritional issues. Calcium deficiency is a big one, because calcium is needed not only to to calcify the eggshell, but it's also needed for muscle contraction. So this long tube sock of the oviduct is essentially a muscular tube, and it regularly contracts, kind of like your intestine does, and it moves things from point A to point B through the assembly line. Also, it's involved in the contractions that start to happen when they go to lay the egg. So calcium is needed for muscle contraction. So if you have a calcium deficiency and you've exhausted all of your body calcium, let's say you've laid 8 eggs and you don't have any calcium left, you may not be able to contract the muscles of the oviduct and actually get the egg out. So treatment with this, when I'm presented with a bird with so-called egg binding or delayed oviposition, the vast majority of these guys can be managed medically. And that means not having to do something invasive. So go in surgically or things like that. The key components of medical management are controlling pain and inflammation. So these birds are often very painful, and that can limit their ability or willingness to push and lay the egg. And if you control pain and kind of let things relax, they're a lot more likely to be able to lay it. The other issue there is that when you're in pain, it activates your flight or fight nervous system, so the sympathetic nervous system. And that works against normal function of the reproductive tract. So it kind of puts things in stasis to a degree. So I'm controlling pain and inflammation. Supportive care, I want to make sure they're warm. It's helpful when I set them up in the warm incubator that there's a little water reservoir that produces humidity. So humidity can be helpful in promoting the passage of eggs. You'll read things like, soak their, butt in a warm water bath or things like that. I don't know how effective that really is, but it probably does bring some humidity into the equation. That could be part of why it could work. Other supportive care is things like fluids. So sometimes these guys are dehydrated, and we want to address that. and calcium supplementation if I'm concerned about a calcium deficiency being part of the issue. And I'll start injectably, where I'll give the calcium in the subcutaneous fluids to give them a boost of calcium. Um, so those are some of the supportive care things we do. A step up from that, I guess you could say more invasive, is obstetrical assistance. And what I mean by that is that we are helping the egg, we're helping to deliver the egg, assisting in that. Uh, let's say the egg is just beginning to crown, um, or they're pushing, 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 and you kind of see it push out and then it goes back in. So you know if you can see it and you know that it's right there, like at the vaginal opening, and it's ready to come out, or potentially even stuck in the cloaca and needs to come out through the vent, you can assist in that. That requires sedation. It sometimes requires anesthesia as well. And then a common thing that's described in the veterinary literature is implosion of the egg. And so what that means is you put a needle, you have a needle and syringe, you put the needle into the egg and you suck on the syringe and you suck out the contents of the egg. And sometimes it collapses in on itself, sometimes it doesn't. But if you suck out the contents, you maybe just now have a shell mostly that you need to get out. Um, there's a question mark there because this technique is not always necessary and it can be uh, used when it isn't needed and can cause its own problems. So I think implosion has value or should be done if the egg can be actually seen and visualized. What I do not support is what's called percutaneous egg implosion. That means you can feel the egg, maybe the hard shell of the egg in that abdominal area through the skin. You know, you're feeling their belly and you can feel it. And you stick a needle through the skin, through the abdominal muscle, through the wall of the oviduct, and then into the egg. I don't support that because you can cause damage without meaning to. That needle could go through a loop of bowel and you wouldn't know it. It also causes damage to the oviduct itself and to the other tissues that you've just passed through. And so sometimes that egg then becomes stuck to the damaged section of the oviduct that your needle went through. And you can also have more internal adhesions where, like, the oviduct ends up scarring and connecting to the muscular body wall or things like that. So I do it if I can get it crowning and I feel like reducing its size is going to make it easier to get out. The caveat to that is that when you collapse it or when you end up breaking pieces of the shell apart, those shell pieces are very sharp and jagged. And all of a sudden, instead of a smooth thing inside the oviduct or in the cloaca or wherever it's trapped, you have like a pine cone in there. So it can cause a lot more trauma to the lining of the oviduct and may, want to try to stick to it, get stuck there and not come out. So some cases do require surgery. That can look like cloacotomy. That means that let's say it's trapped in the cloaca. We make an incision through the body wall, through the wall of the cloaca to get to the egg, and then remove it that way. So when you open up the cloaca, it's called a I can even talk. Cloacotomy. I cannot. Okay. Salpingotomy is when we're opening up the oviduct. So let's say I have a egg in the oviduct and I go into the coelomic cavity, identify the oviduct, make an incision in it, and remove the egg. Sometimes we have to do a salpingohysterectomy. That is a term that describes surgical removal of the oviduct. It does not include removal of the ovary, which is largely not a feasible or safe thing to do in birds. So like spaying them, so like removing their ovary and their oviduct so they have no reproductive tract is really not something that we can do or should do. The term salpingohysterectomy comes from the fact that the oviduct is basically a hybrid of an oviduct, but we still call it that as the main word, or salpinx, and a uterus, which we call the shell gland. And so removal of an oviduct, let's say someone goes in to you as a human and takes out the fallopian tube, that is a removal of the salpinx. And then if they remove the uterus, that's a hysterectomy. So we refer to removal of the whole length of the oviduct, which includes salpinx and uterus, as a salpingohysterectomy. And I don't know why my brain was misfiring. Cloacotomy is the way they pronounce that word. Anyway, um, so also when medical management isn't working, um, and the egg is not appearing, it's not even starting to crown. That's when you start to question whether the egg is even in the oviduct anymore. Is it so-called ectopic, which means free within this limit cavity? And you also wonder if there's something drastically wrong with the oviduct, such that the egg cannot come through and be laid. So do you have severe inflammation or infection of the oviduct? Do you have cancer there? Do you have adhesions between it and other organs in the body cavity? And is it even twisted on itself, or torsed? So some other forms of reproductive disease to talk about is cystic ovarian disease. And this is when the ovary starts developing cysts. So it sometimes does that just spontaneously for reasons that aren't well understood, and that's what we tend to call cystic ovarian disease. Sometimes the cysts are being created by cancer cells. So sometimes you have ovarian cancer, and then that produces cysts. But you can have so many of these that they take up a ton of room within the body cavity, and the bird presents with a distended coelom. This is something that's pretty easy to identify by ultrasound because they have a really classic appearance. You can see all the little cysts. And then they don't really respond to medical management. Like typically, if you give this bird Lupron, it's not going to make these cysts go away. So if there are maybe just one or two, you might be able to just drain them, whether you're in the abdomen doing surgery anyway, or maybe with ultrasound guidance. But if there's a whole bunch of them, you have to surgically remove them. And that is going to sometimes include removing part of the ovary. I mentioned that we can't really remove the entire ovary, at least not safely in birds, but we may remove part of it, which is called an ovariectomy. And that can be happen as part of removing all these cysts. So here is a picture after surgery, where in this individual, we have some egg debris that was trapped within the oviduct. The oviduct has been removed, so a salpingohysterectomy has been performed. And P.S., this ovary had 1 million cysts on it. We took those off at the same time. Oviductal impaction. So this is when the oviduct becomes distended, sometimes hugely so, with retained egg material or egg debris or eggs. So what I mean by that is it can just be like liquidy yolk. It can be like firm yolk, like a hard-boiled egg type yolk, which can accumulate in layers, like the layers of a pearl, or like the formation of a pearl. And there can even be eggs buried within all that stuff. So basically built up yolk, built up whites, built up shell membranes, built up actually calcified shell, basically eggs and any components thereof. The oviduct can get so full that it tears open and ruptures and releases its contents within the abdominal cavity. But it can contain any of these things or a combination of them. This is a postmortem photo of a cockatiel. We did a necropsy. The ovary is here. I should orient you that the head's up this way. Obviously, feet are here. So this is the left side of the bird where the reproductive tract is. You can see the yolk, the yolks or follicles on the ovary. And then the oviduct, which is this big tube socket, shouldn't be so expanded and filled with fluid like that. And it has a lot of yolk in it. This is an example in a chicken. Basically, we're lifting up the body wall here, and pretty much the entire body cavity is filled with this hugely distended oviduct. So why does this happen? Well, the oviduct can be malfunctioning in the sense that it's creating too much egg white and the other components of the egg being secreted in there. You can have a trapped egg or egg material that then makes everything back up from there. So nothing can move through there. It's basically obstructed with that. And these conditions are more likely to develop when you have inflammation or infection in the oviduct, um, when you have an egg stuck, which acts as, obstruction to everything coming down the line. After that, uh, the oviduct has twisted on itself. It has cancer. It's torn open in one area, things like that, and it sets the stage for things to be able to build up inside. So they can get so big that the belly protrudes, and they have distension of their belly. And there's a lot of times so much inflammation that the body puts fluid in there, and you have a bunch of what's called ascites or fluid within the body cavity. Um, these are some examples. This is that same little cockatiel I was showing you, but before we pulled that oviduct out. And this is during surgery where an impacted oviduct has been exteriorized. This one is probably a chicken, given the size, maybe a large parrot, in preparation for removing that material and removing the oviduct. The material that comes out of there can be what we call laminated, so many layers like that. And it's because, it starts with maybe a small nugget. Again, I kind of think of pearl formation. It starts with a small nugget of something trapped in there, and then the oviduct puts more and more and more and more layers on the outside of it. So these and other forms of reproductive tract disease also can present with vague clinical signs. A person may report that they were laying eggs and they kind of abruptly stopped, and maybe that was months or years ago, even. And it takes time for these to get bigger and bigger and bigger and then become clinical. So, to make a definitive diagnosis and to address and solve the problem with an oviductal impaction, we need to go in surgically. An exploratory celiotomy refers to entry into the body cavity or coelom, and basically exploring, going, okay, what do we got? This is not done until other diagnostics have been performed, namely imaging, to figure out exactly what's in there and kind of how we need to approach and get to it. But a good thing about it is that it gives you the opportunity to actually collect some samples for, let's say, biopsy if you're concerned about cancer, and also for like culture. Where these days we do a lot of the kind of next generation sequencing, uses genetic analysis to identify microbes and their antimicrobial sensitivities. The thing is, let's say you're worried that the oviduct is infected, or all that trapped yolk is colonized with bacteria. It's a great culture medium. You cannot get a sample like outside the bird to tell you that. You can't stick a swab up into the cloaca, for example, and try to get into the oviduct. You're just going to get fecal bacteria. So you have to actually be in there and be able to have access to the inside of the oviduct and that material to get cultures or to get tissue samples for biopsy. When you have an oviduct that's huge and filled with all the stuff, and let's say you have bacterial colonization, um, antibiotics alone are not going to solve that, because antibiotics only go where the blood supply delivers them. So it's just maybe at most the periphery of all of this layered debris. And the bacteria can be sequestered and live happily in the midst of all that debris and never be touched by the antibiotics. So antibiotics are part of treatment when there's bacterial infection, but surgical removal is ultimately needed to actually solve the problem. If you have an acute impaction, let's say you have a bird with a log jam of like 2 or 3 eggs in there, but the oviduct is not horribly diseased. It's not filled with debris. It's not infected. It's not torn open. You can just do a salpingotomy. That means cutting into and opening the oviduct just to get out the stuff, the eggs, etc., and then clean it out and close it up and not seek to take it out. Yes, that bird may then go on to do the same thing again. But there's more risk involved and surgical time and anesthetic time involved in removing the oviduct or performing a salpingo-hysterectomy. And so if it's not absolutely needed, don't always do it. If the oviduct is just trashed, it's really, really diseased, maybe there's masses growing on it, there's cancer involved, things like that. Or it's like some of those pictures I showed you where it's just so full of stuff. It's like you're not going to salvage that. You're not going to return it to health and functionality. And so you just go ahead and remove it. And this is an example of what this can look like, one of these big lumps that came out of the oviduct, in addition to some other smaller ones. And you cut it open and you can see all these layers or laminations. So ectopic ovulation, also called internal ovulation, that's when that ovum or that yolk misses the infundibulum, it doesn't get into the oviduct, and it just splashes free within or falls free within the abdominal cavity, or it made it into the oviduct, but the peristalsis of the oviduct that's supposed to move it down the line in the right direction isn't working properly. And so it basically it goes back the other way. It's called retropulsed and falls out the front, falls out the infundibulum. So if that happens, because basically the oviduct isn't working properly, maybe the ovary itself is diseased, which is called euphoritis. Um, or the oviduct is already impacted with stuff and there's no room for it. So maybe it just goes in there and falls back out, or it can't go in the first place, which is spilling out the infundibulum. In those circumstances, yolk gets free within the body cavity. And you know how a yolk can stay intact? Like when you crack an egg, it stays whole or it breaks. That the same thing can happen inside the bird. So sometimes they stay whole, and we later find these sort of old, they look like hard-boiled egg yolk that are just bumping around the body cavity, or it breaks and the yolk oozes over everything. And there's a bunch of organs right next to the reproductive tract that gets coated in yolk, and that includes the GI tract. And that causes a lot of inflammation. Or peritonitis, as we call it. So when you have lots of inflammation of your body cavity, we call that peritonitis. It causes a lot of pain and discomfort. And some birds are so stoic that they really don't show any symptoms, and maybe the egg yolk doesn't break. So it's just a single egg yolk in there, and there's enough space for it, and it doesn't really make them feel bad. But alternatively, they can present with like acute lethargy, coelomic pain, when it's been going on a long time and they've been so-called internally ovulating for many months or years, the belly can get so full of yolk, you just can't believe it. It's so full. And the belly becomes really big, and all that inflammation over time can result in abnormal connections or adhesions between bowel loops stick together, bowel sticks to the body wall, the oviduct sticks to the bowel, like all these organs start sticking together, and that can cause its own problems. So yolk peritonitis, it can be sterile, which is usually true in parrots. It can also be septic. And what that means is that there is microbial colonization, usually bacteria, of that yolk. And that is more likely to occur in poultry. Coelomic adhesions, like I described, can rapidly form and then like persist lifelong and cause problems much later down the road. And when they have really sudden peritonitis or very severe chronic peritonitis, these birds don't feel well, they may not eat well, their guts may not work very well because they're stuck to everything. And the belly dilates and becomes enlarged, and they oftentimes build up fluid in there. The fluid happens for a few different reasons, but the simplest explanation is when there's a lot of chronic inflammation or peritonitis, fluid has a tendency to form. So what do we do about this? First of all, mild early stage yolk peritonitis, typically medical management is what we do. If I'm concerned about the bird going on and just ovulating more and more and more and adding to the problem, I might seek to shut down the reproductive tract, so-called artificially, by using a GnRH agonist. Pain management and controlling inflammation are essential. And so that's the main thrust of the treatment to get them feeling better, in addition to supportive care like fluids and nutritional support if they're not eating well. If we're concerned about there being bacterial colonization, that may be based on a really high white blood cell count, or let's say we drain some of that fluid out of the body cavity and we culture it, or we look under the microscope and see microbes, we would want to use appropriate antimicrobials. When they have a lot of fluid, that's built up in there. It's so full that they can't even hardly breathe. We want to drain that fluid out. Um, if, however, let's say a bird has been internally ovulating for like 3 years and it has like 20 yolks just floating around in its belly, taking up all the space, or just loose, like just egg crud can really build up within the coelom. You have to get that. You have to physically remove it, and it needs to come out. And when you're in there, you're going to usually find a lot of adhesions, and you try to resolve those. It's also a great opportunity to collect samples for culture or next generation sequencing. So here's an example of a bird where we've opened up the body cavity and all of this yolk and this like maybe used to be shell membranes and stuff or just flow out. So you have to remove that and you literally kind of wipe it out and clean it out to stop this ongoing process of peritonitis. So an entire egg can become ectopic too, so lost within uh, the coelomic cavity. That can happen if the oviduct ruptures and it falls out. Um, or, like I said, it can actually like retropulse out, like it gets made and then it goes back the wrong direction and comes out. There may not be any symptoms of this at all if there's just like one egg. Sometimes the egg is kind of partly collapsed, so it doesn't take up as much space. Um, and they may not feel great. There can be some peritonitis and some fluid that builds up as a result. Um, uh, but sometimes it can be symptomatic and early on. So we identify that by feel. Sometimes we can feel it with an exam. X-rays and ultrasound can help us identify it. It can be difficult to determine whether it's still in the oviduct or not. The way we figure that out is its location. So is it positioned in a place that's consistent with where the oviduct is positioned? Or is it somewhere totally weird? Does it have, if it has a calcified shell, we should be able to see it radiographically. And ultrasound, I think, is a little bit more useful as figuring out if it's still in the oviduct than just an X-ray, because sometimes I'm able to see the oviductal wall around the egg. I still can't always tell for sure. Sometimes it still comes to exploratory celiotomy or surgery in order to know for sure, and of course, to remove it and check out what's going on with the rest of the reproductive tract. So I mentioned the cystic right oviduct. So that little vestigial right oviductal nubbin that's left from the embryo can become usually cystic. Rarely does it become cancerous. And it can be really big. It doesn't cause a problem until it gets space occupying and it's so big and it's pushing everything out of the way. I had one in a budgie once that had taken up the whole coelom. And so they can be drained oftentimes without having to open them up at surgery. But then the expectation is the fluid will refill. So the way you cure it is you actually have to go into the body cavity and you remove it. You kind of ligate it right here where it's connected to the cloaca and you remove the whole thing and it's curative. So what about cancer? Unfortunately, we do see that a lot of the ovary and the oviduct. Usually, the most common types of cancer are carcinoma or adenocarcinoma. This is a postmortem photo of a budgie where you can see a tumor has basically replaced the normal ovary. So how might a bird feel? What might be the signs in this case? You're going to start seeing a pattern here, and that is that there can be non-specific clinical signs. So with any kind of reproductive disease, so they don't feel good, right? So they're lethargic, they're depressed, they're not eating well, they have a reduced appetite. You may see difficulty breathing in any of these conditions when there's space occupying things, an impacted oviduct, mass, fluid within the body cavity, and it's compressing the air sacs. So they can't inflate them and they can't ventilate properly. A bird may be straining, especially so if they have an egg kind of stuck in there. Um, and they would be having difficulty passing droppings as well. And so much so that they can retain droppings. And let's say they haven't pooped for like 12 hours and they finally do this huge explosion of a poop. Those will oftentimes smell. because the bacteria that's part of normal GI flora has just been stagnating in there and flourishing and multiplying. Things I might see on physical exam, first of all, I might go, yep, that bird's lethargic. I can tell it feels poorly, it's fluffed up, it doesn't care that it's in the exam room, it's just keeping its eyes closed. I may find that it's dehydrated and thin. Cachexia means muscle loss or wasting if it's been going on long enough. I may appreciate that they're breathing fast or shallow or with a lot of effort. And I really want to feel that belly because I want to know if there's distension, is it pooching out? And if so, why? Sometimes I can tell just by feel that there's likely to be fluid in there or appearance. Sometimes I can feel a mass. I also will feel for the gizzard. The gizzard is the grinding part of the stomach. And based on its position in the body cavity, if it is pushed out of its normal position, it tells me that there's something that is pushing it out of its normal position. And that can be the reproductive tract based on how closely spaced they are together. Tenesmus refers to straining in passing and dropping, and maybe even some blood. So they're straining and blood is coming out in the droppings. This is a picture. This unfortunately was a bird who was having surgery in a valiant effort to try to remove this large tumor of the oviduct, but did pass during the procedure. And so all the drape and other things were taken off, and this picture was taken basically post-mortem to show what was going on there. So anyway, people will present their birds with these kinds of complaints as we just discussed. And these are the kinds of things that I'm looking for on exam. But I just wanted to show you that additional photo. So what about treatment of this? Well, if the tumors are localized enough that we can remove the whole thing, let's say we do a salpingo hysterectomy and it takes the tumor out in its entirety, that can be curative. If there's an ovarian tumor that is discrete enough, as we say, so it's going to, we can remove it without having to try to remove the whole ovary, which is a little too dicey. We may be able to cure it that way. A lot of tumors are estrogen responsive or estradiol sensitive. And as a result, if you lower estrogen or you block estrogen receptors, the tumor will sometimes stop growing or slow its growth or even shrink down. It gets smaller. So using GnRH agonists to stop the estrogen stimulation, sometimes together with an estrogen receptor blocker called tamoxifen, which is an oral medication, you can sometimes get these tumors to shrink down, which you want to do if you can before trying to actually remove them. The difficulty is that usually ovarian and oviductal cancers don't become clinical, so they don't develop recognizable symptoms or have physical exam abnormalities until they're big and advanced and spread around more and harder to fully remove. Depending on the nature of the tumor, there are potentially these days some radiation and chemotherapy options that can be pursued. Sometimes we seek only to keep them comfortable. So palliative treatment, like a hospice kind of approach. That involves keeping fluid out of the belly and draining it as needed. And also, of course, just generic supportive care like fluids and tube feeding if they're not eating. Controlling pain and inflammation, keeping them comfortable, are sometimes all that we can do. So in general terms, what kinds of birds are going to be presenting to me with reproductive tract disease? Of course, they're going to be adults, sexually mature adults, usually young to middle age. Sometimes older can happen, but usually young to middle age. Sometimes there's a nutritional history, let's say an exclusive seed-based diet with no calcium supplementation or something like that. That sets the stage for these problems, and it kind of perks my ears up because I realize that this bird may be more likely to have reproductive disease. Again, being a little bit redundant here, but these are the kind of presenting complaints that people will have, even to include prolapse. So a person says, I'm seeing blood or I'm seeing something coming through the vent. So a prolapse can be a complication and a part of this. And it usually happens from straining, trying so hard to lay an egg, that eventually tissue just prolapses out, which means it comes out kind of inside out. I sometimes find that these birds are very, very thin. And they're sometimes having so much breathing difficulty that I need to put them in oxygen right away. I may find that there's a lot of fluid within the body cavity, and if I can drain that, I can quickly improve their breathing. I may appreciate that they're showing signs of pain. So signs of pain can be pretty generic, meaning like this bird here. You can't look at a bird like this where it's keeping its eyes closed and it's fluffed and stuff. You can't tell whether is it painful or does it feel nauseated or does it feel just kind of generally poorly, just crappy, right? Because it all looks similar. However, there are some postures that can kind of suggest that. So when their tail is really drooped, you kind of see this hunched rump area. Of course, when I'm touching the belly and they're reacting painfully, that is going to give me a sense of them being painful. And I'm, looking out for prolapses, which need to be specially addressed as well. This little bird here has basically this big kind of lump that's protruding almost out one side of the belly instead of just the belly being kind of big overall. And that is a hernia. So here's an image of a prolapse in a cockatiel. These are, the general physical exam findings that I see with reproductive disease. And, you see a lot of these repeat things because they look similar for different types of reproductive tract disease, and the symptoms can be relatively vague. But there are hernias sometimes, like we saw in that little cockatiel. And when I see something like that, I have to distinguish a hernia from just a stretched out distended belly because they can look really similar. And then I also have to figure out what's in the hernia. A hernia, by the way, for those who don't know, is that a opening or tear forms in the abdominal wall, the muscular wall of your abdomen or their abdomen. It tears open to various sized hole, and then various contents of the body cavity can come through that opening, including like intestine, into what we call the hernial sac. That's just kind of coming off of that belly. This is a very severe prolapse. You can see that there's a lot of tissue that is exterior here. When I'm presented with that, one of the first things I have to figure out is it a cloacal prolapse? So the cloaca, we talked about how it's kind of like a bladder and it receives all the different systems. Is it turned inside out and sticking out through the vent? Either partially or totally. Or am I looking at a prolapse of the uterus or the vagina that is coming inside out at me? Those tissues are not supposed to be exposed to the air, obviously. They get, and they're kind of pinched coming through the vent. And so very swollen, damaged, bloody, they dry out. Some of the tissue will begin to die, things like that. And in extreme circumstances, I did see a case one time where the oviduct tore in half, and then the lower part came out completely, but inside out, so prolapsed. And in that instance, you can't just stick it up in there, right? If it's a cloacal prolapse, then reducing it, that's the term we use to putting it back inside out, or right side out, putting it back inside, is going to be part of your process and your treatment. But if it's an oviduct like that, realistically, you need to go into the body cavity and remove that part of the oviduct. You can't just sort of cut it off like it's coming out or just push it back up in there. So when we're presented with one of these cases, I have to go, okay, what is the best intervention? What is the right thing to do in this case? It's essential that I have a really good grasp of anatomy and physiology and how everything works and where everything is located in the body. I also have to choose what's the highest yield diagnostic method. What tests should I do? Should I prioritize? Let's say I have a debilitated and weak bird that can't tolerate every test under the sun. I need to prioritize what's most important, what's most likely to give me the answers that I need to move forward. And also that takes budget into consideration. I don't want to do a bunch of tests that aren't necessary when I know that we're going to need to have funds for maybe a surgery or something like that, or hospitalization. Um, so I need to do whatever I can to figure out what exactly is going on. What is the pathology here? And then I can decide is a medical approach appropriate? Is a surgical approach appropriate, or some combination of the two? So the diagnostics that I rely on, first of all, I can learn a lot just from the bird's history and the physical exam. X-rays can be very, very helpful. We also use fluoroscopy quite a bit, which is kind of like video X-ray, if you will. So you can see things happening in motion. Ultrasound is a hugely important tool to get a lay of the land as to what's going on within that body cavity and those organs. Also using CT or CAT scan. Most of these, or I should say X-rays and fluoroscopy and CAT scan can be enhanced with contrast to give you even better visibility of what's going on. Clinical pathology refers mainly to things like blood work, fluid analysis. Let's say you suck fluid out of the belly and you analyze it and look at it. I don't reach for blood work all that much in these cases. It depends on the situation. Let's say I'm really worried about kidney function impairment or something like that. Then I might go, yeah, I want to know what the kidney values are, for example. But I may not prioritize blood work because it's not going to give me enough specific information about the problem. I may be spending dollars that I don't need to be spending that way. And I'm going, let's say this bird is bleeding and already has blood loss, and I'm anticipating that I may need to go to surgery and there could be more blood loss. Well, I'm not going to waste any blood on blood work in that case. We can learn some things about the fluid that we suck out, um, its appearance, what kind of cells are in it. That's not always informative, but it can be. And we may even like culture that fluid, or if we go in surgically, material or tissue that we remove. Um, and histology refers to biopsy of such tissues. So, um, again, I need a good lay of the land, as I like to say. The better I understand the layout, if you will, or the nature of the pathology in there, I have a better idea about how I need to approach it. And if I do need to do surgery, what's the best approach? Like, where do I come in? What am I looking for? What am I hoping to accomplish or remove? And then I'm also going to understand more about prognosis. The better I understand the condition, the more accurate the prognosis I can give to the owner is. So on radiographs, just to orient you here, our head's over here, this bird's laying on its sides. This is called a lateral radiograph. And the location of the reproductive tract is generally up in here. So I'm kind of circling the kidney. The kidney is like sausage shaped. It's like long and sausage shaped in birds. And just below the first part of the kidney here is going to be the ovary. The oviduct then is all folded and twisty-turny in this region here, sitting right underneath the kidneys. So in this particular bird, if I blow it up a little bit, I go, okay, I can see that kidney silhouette here. I also see something else. Like I see like kind of a mass thing here that doesn't quite make sense. It can be tricky because you have a lot of organs packed into a small body cavity. So like this is the stomach, this is the gizzard, and you have loops of intestine that are all looped in here. And so when I see this, I might go, okay, is that some weird loop of intestine? Or is that the oviduct? Is that coming off the ovary? What is that? With x-rays, we oftentimes invert black and white, which can sometimes just help your brain see it a different way or see it a little bit more clearly. But I would need to take some additional steps here to understand what I'm looking at. I might be able to see the structure on ultrasound. That would probably be the next thing I would do. And I would have a better idea if I did a CT as well. Fluoroscopy, where we use our video x-ray, essentially. I'm realizing this is a little video here, I think. Oh, maybe not. Okay. This is a chicken standing here, and you can see this egg here. We use it either to supplement x-ray or sometimes instead of x-ray because it's lower stress. They don't have to be held down and restrained for it. And the motion allows me to see like the GI motility. If this egg is still in the oviduct, which spoiler alert, this one it wasn't. It was free within the abdominal cavity. What I'll see is it'll move with the peristalsis of the oviduct. So seeing that motion can be really helpful. The same can be seen on ultrasound as well. Again, ultrasound is an incredibly powerful tool for us. We can identify fluid right away, cysts, eggs, follicles, lost yolks, and abnormalities of the other adjacent organs as well. When I'm wondering about, let's say, an impacted oviduct, so in this case, I see this thing here, and I go, is that a living mass? Is that a tumor? Or is it just a ball of dead crud inside the oviduct? What I'll do is I'll turn on what we call the Doppler function. That's what gives you this color flow to show blood flow. So in this instance, I can see that the periphery has blood flow. That's going to be the oviductal wall, but this doesn't. It's just like an egg nugget. If there's vessels and blood flow all throughout it, I go, oh, that's a mass. So those are some of the tools I have to use. General things about treatment, we've already discussed some of this, but just to review a couple of things. General support is good. I need to have them warm. I need to make sure that they have oxygen if they need it, if they're having trouble breathing. Humidity can be helpful, especially with our birds that are having trouble laying an egg. And they may need nutritional support in the form of tube feeding. Pain management is very important. I'm usually using a combination of an opiate, an anti-inflammatory or NSAID, non-steroidal anti-inflammatory, sometimes even a local anesthetic. Let's say I have a prolapse. I may be applying lidocaine to that. And I oftentimes use gabapentin as another type of pain control in combination with these others. Fluid therapy, usually subcutaneous fluids most of the time, supplementing calcium. And then in some cases, we do want to expediently suppress the reproductive tract and get it quiet. Lupron is going to work fastest. Deslorelin implants are going to take a little bit more time to work, let's say a week or two, but will last longer, a few months. When there's a lot of fluid in the belly, I need to drain it so they can breathe better and it takes the pressure off. And I might have, let's say an egg is kind of just starting to poke out, but it can't come through. I may have to assist its delivery with obstetrical assistance. I'll show you some photos of that. Sometimes sucking out the egg contents or collapsing the egg is helpful. Sometimes it's not. So we have to clean and sanitize and put topical anesthetics on prolapsed tissue. And it's sometimes necessary to temporarily put sutures in the vent to narrow it so that everything doesn't just fall right back out. And then all of these different forms of surgery, removing material from the oviduct, from free within the body cavity, removing diseased tissue, removing cysts, are all things that come into play in some of these cases. So here's an example of obstetrical assistance. This is a little sun conure. And what you can see is, oh, kind of a bulge going on here right around the vent. And this bird is anesthetized. Sometimes sedation alone is okay. And very, very gently, we're putting some pressure here because we can feel that there's an egg there. And we're putting pressure in front of it to try to coax it out of the vent. Here we see that it is kind of starting to crown, and we want to make sure that we lubricate and moisten these tissues. And they tear really easily, so you have to really, really delicately tease the egg out. The ultimate goal is you can pop that sucker out. So this is an example of obstetrical assistance. Now, a lot of things to consider preventatively. So we talked about some of the behavioral aspects of all of this, but going into that a little bit more, this is kind of our last segment of the talk. We'll be wrapping up soon. So life balance. This is important in the sense that sexual behavior is normal. Reproductive behavior is normal, but it's just one part of life. And you could say that to some degree it falls into the category of a life balance of social interaction. So courtship and mating and nest seeking, all the things related to reproduction kind of fall into this category. But in the wild, they have a number of different things happening in their lives. Foraging is a really important part of what they do on a daily basis. Social interaction, whether kind of friend zone, like we're flock mates, we're friends, we forage together, we play together, but we're not intimate partners. Falls into social interaction, and then also pair bonding, and a sexual partner falls into that. And then caring for our feathers, bathing, preening, all of that good stuff. And so uh, in captivity, the life balance can get skewed in one direction or another. Um, and sexual behavior is part of that. So let's say, there's nothing else to do, really. Food's readily available, all the food I could possibly need. And plus, I have identified a mate, and that is my owner. And we interact regularly in a way that is stimulatory to me. So, courtship type behavior, and they don't intend it that way, but that's the way I read it. Um, and I have this one toy in my cage I like to masturbate on, or there's a great place that I go and try to find a nest, chewing up the baseboards or going into a closet or whatever. And they can be almost, if you will, hyper fixated on that because that's kind of like the only game going in their life. Everything's about sex because there's not alternative things to be occupying oneself with. Um, so other points of focus in life, redirecting away from reproductive activity is exercise and doing something active, blowing off energy that way, foraging, training, playing. Um, and then when we're interacting with our birds, we want to encourage the friend zone, so to speak. That's what I have to do with my birds, but pretty soon they're regurgitating to me and masturbating on me and the whole thing. So um, we try to kind of keep things at arm's length, so to speak. So the kind of interactions that really facilitate a pair bond and sexually stimulate a bird are a kind of close, intimate contact, like they're hanging on your shoulder a lot. This is kind of an intimate zone. They really like to snuggle in here under your hair, or they're preening you and you're scratching their head, basically preening them, or they're in your shirt or in the bed with you. Um, So I try to keep my birds more on the hand or the arm. I really kind of avoid the shoulder, except for brief stints. Um, I'm not really wanting to snuggle or stroke or pet or cuddle with them. Um, and then you'll hear a lot of things about like, well, as long as you don't stroke their back, like the head's okay, like head and neck is okay. And then as long as you don't stroke their back and stuff, you're fine. Unfortunately, that's not technically true. Um, if they're sitting here and you're doing head scratches for like an hour, like that's like foreplay. I mean, that's what the birds do in the wild. They sit together, they preen each other. It's called allopreening. And that is part of courtship. It's part of foreplay. We don't mean it like that, but that's what the effect it will have on them. So one of my Timnas, my female Timna, I can give her a couple of head scratches. That's it. If I get 3 or 4 head scratches in, she's regurgitating. And then, so what I'll do at that point is I'll redirect her to doing something else, or I'll kind of retreat and kind of disengage rather than kind of feeding into and continuing that behavior. Appropriate diet is really important because excess calories and food being too easy to find are things that stimulate them reproductively. So going back to that HPG axis, external stimuli telling them when it's appropriate to breed. They don't cycle like we do, like so-called going into heat, or for that matter, getting old and having menopause. They don't do that. They rely exclusively on external stimuli to tell them to turn on the reproductive tract and tell them that it's time to breed. And those things include dietary calories, how easy they are to get. They also include the presence of a perceived mate, so pair bond interaction going on between us or another bird, the presence of a perceived nest site or nest material, and photoperiod in season coming into that a little bit. So in the wild, when it's spring and summer, food's abundant. There's food everywhere and it's really easy to get. Maybe you have to spend like 20 minutes of your day gorging yourself to the point that you have more calories than you even need. You're starting to develop reserves, maybe some fat reserves. That tells the brain, oh, I've got plenty of food. It's easy to get. I don't have to spend much time doing it. And I even have reserves to support raising young. So let's do this. The other thing that happens is that I don't have to spend much time with food acquisition. So I have all this free time to just make out. right? And seek out nests and dig out nest cavities and mate and the whole thing. Um, in fall and winter, when things are scarce, all of a sudden I have to spend most of my time foraging for food just to get by, not even have reserves. So maybe just maintain a lean body condition. I don't have extra time or focus or resources to support reproductive activity. Maybe I have a partner, but most of us we're both spending all our time finding food. We don't have time to be messing around a whole lot. We don't have time to be seeking out nest sites, things like that. And that turns off the reproductive tract. So the natural way that we can keep reproductive activity at a minimum is by going, I'm going to give you what you need nutritionally. I want to make sure you have enough food, you're not underweight, you're getting the nutritional balance that you need. Um, but it's not going to be super abundant. It's not going to be excessive in calories. I'm going to ask you to forage for it. And what that does is it mimics kind of that fall, winter period in the wild. The way I interact with you. Maybe we kind of have a pair bond going on, but I don't want to feed into it too much and basically engage in a lot of what is essentially courtship behavior with you. Kind of be just more friend zone. If there's an area that you perceive as a nest, like a drawer, and you're climbing in that and you're tearing up all the Chinese takeout menus in there, whatever, I'm not going to let you have access to that area. Instead, hey, let's open these foraging packets together and I'll show you how. So controlling those variables can help us keep reproductive activity at a minimum. Sometimes we have to use artificial means with Lupron or Deslorelin implants to help control the situation, but they shouldn't be relied upon as a sole strategy. So things about food. There are different recommendations for different species groups, so this isn't a one fits all necessarily, but for most species, we want kind of a base diet of pellets, at least 50% of the diet or so. We want to offer fruits and vegetables, more so vegetables than fruit, because that has a lot of simple sugars and less nutritional value. Seed and nuts should make up the minority of the diet. When we're talking about like budgies and cockatiels, lovebirds, my opinion is that it's perfectly okay to be about like 50% of the diet and have more seed for those guys. So there's, again, differences in species. But basically, um, we want to at least have a pellet base supplemented with veggies, a little bit of seed and nuts. Supplements may not be necessary depending on what they're eating. If a bird is eating only seed and I'm having trouble getting them to accept pellets, I might go, okay, let's make sure you have a calcium supplement, like a cuttle bone or something like that. Um, but again, it varies by species, but we want a nutritious, balanced diet, but we also don't want to overdo the amounts and overdo the calories. So if I have a bird that, let's say it's been laying eggs constantly, I'll have the same conversation that we've been, with all the things I've been saying, I'll have that conversation with the owner, and dietary changes may be part of that. So let's say they only eat seed. I'm gonna go, okay, we need to introduce pellets. We need to teach them that it's food. We need to gradually work on them accepting pellets, so that can be an important part of the diet. But we have to do so carefully, because if they're not eating it well, we could be inadvertently starving them and causing problems. So monitoring weight is important. Keeping them busy, having things to do, activities, exercise. If it's possible to allow them flight, that's great. We want to do that. And we want to keep them really busy with play, toys, but also foraging tasks as well. This little gray parrot here who's going in the drawer and tearing everything up and basically nest seeking, allowing them to engage in those behaviors, can feed into reproductive activity. And there's a lot of different ways to incorporate foraging into the daily routine. And a lot of times we have to teach them these tasks. They may not know how to do it. And there are some simple ways to start with foraging with different, basically, food sizes of food items that they have to kind of break down. That's very, very basic. And then we can put known food items into different shapes or contexts or locations, and even spreading it out between multiple different bowls so they go to different places in the cage to access it. So it's some of the most basic type of foraging. But those that include or require some teaching is mixing food with inedible items or materials. Um, and I love the corrugated cardboard toys that are out there where you can stuff that with treats or small pellets. And those species that like to forage on the ground, putting like these artificial grass mats or kind of these like slow feeder bowls for dogs there, and having them forage for food in there. And also like in foraging boxes where there's all this debris to play with and chew on, and maybe underneath that there's food. There's puzzle toys as well, which take a little bit more step-by-step teaching, and even searching a room for certain food items if you have a room set up that it is as safe as possible. Covering the food bowl with paper, that's a basic thing. And then also teaching them layers of foraging packets, where at first you're wrapping something in paper, then that goes into maybe a Dixie mouthwash cup, and then that goes into a toilet paper roll, then that goes into a cardboard box. Maybe not as big enough a one for them to crawl in and make a nest out of, but all these different layers, and they ultimately tear into it and get down to the treat inside. Just a note about safety. A lot of times people are concerned when they're trying to add to enrichment and foraging because they're not sure if something is safe or bird safe. The fact that there's nothing that's 100% bird safe, except for like a cardboard or like an aquarium. It was an aquarium with no enrichment at all. It can't hurt itself, but that's no life at all. And so, um, we kind of inspect the toys. We go, do I see anything that looks kind of hazardous here? Could they get caught here? Do I think that, yeah, was this just kind of made in China? I don't know if the dyes are safe or things like that. So we use our best judgment in choosing safe things, but ultimately we have to monitor them and see how they engage with the material. Do I see them chewing it up and spitting it out? Do I see it disappearing? Do I think they're actually eating something? So we shouldn't be paranoid. We want to give them things, but we should be vigilant. We should pay attention to what they're doing. So I know I probably went a little bit over time, but I think we still have some time for questions, and I'd be happy to answer any questions that you have.
Hey, wonderful. Thank you, Brenna. That was awesome.
Yeah.
Let's see. Yeah, we'll go to water here. And I will see where we should start with our questions. There was definitely some discussion on medication, so I think we'll talk about that. And then the one question that we received, um, let's see, Amy asked, can you differentiate between a cyst and a tumor on the ovary in an ultrasound? And then there's a second part to that question of, is it common to poop blood when a parrot has a tumor slash cyst?
Okay. So, yeah, ultrasound is a really, really good tool to tell the difference between a solid tissue tumor and a cyst because they look totally different on an ultrasound. They may look the same on an X-ray because they just both look like a shadow of some kind of silhouette. Um, so ultrasound, I usually reach for. CT can sometimes help you because you can tell the difference using CT between fluid and soft tissue. Um, but yeah, those are great tools for that. Um, and as far as passing blood, so if we have like a cyst or a tumor that is involving, let's say, the ovary or the oviduct, you're not very likely to have blood coming out externally. You would have to have a tumor or, let's say, trauma or bleeding from a stuck egg in like the latter part of the oviduct that's getting close to its interface with the cloaca, or a tumor or damage to the cloaca, the tissues in the cloaca. That could very well come out in a dropping or out the vent. Um, and then sometimes an egg will have blood on it. A little bit's okay because, the tissues can tear just a little bit, like as the egg's being pushed out. But if there's like a lot of blood on the egg, the concern is that that blood came from the oviduct or the cloaca or even the vent on the way.
Let's see. We just had a question come in that was talking about on a calorie or a calorie restricted diet.
Mhm.
Um, And so this person has a little cockatiel.
Mhm.
And they say, when there was constant screaming for food and 10 plus gram weight swings from AM to PM or PM to AM, how should we manage some of that behavior?
Yeah. So, first of all, it's helpful to get an idea of the bird's body condition, meaning how well is it muscled versus does it have fat stores? Is it like a lean or ideal body condition, or are they so-called over conditioned, so overweight or obese, or are they underweight and thin? So, knowing what their body condition is in context with their body weight is really important. And so, the best way to do that is have them examined at some point by a veterinarian. And we want them to be looked at least yearly, ideally, because that gives us a chance to look for changes over time that you may not appreciate seeing them every day, and also to catch disease earlier. But weight is just a number, so to speak. Um, a lot of things can influence it. And so it's really important for us to connect it with the body condition of the bird, which requires examination. Um, so weight fluctuates a lot from AM to PM, usually related to eating. So the most true weight or accurate weight is going to be first thing in the morning before they have eaten and drank very much, because usually they're not having done that very much overnight. Um, so the reason why it can be 10 grams easily, even on a cockatiel between AM and PM, is they can have a full crop of food because they've been chowing all day. The crop holds a lot of food and adds to the weight, and also the food that's going through the GI tract can affect it as well. And the amount of poop, let's say they haven't pooped in a while, the big poop, that can be like a gram or something like that. So mainly the contents of the GI tract, eating and drinking, is going to cause those kind of rapid swings in weight between morning and evening. Um, there's nothing wrong with weighing them morning and evening and just kind of keeping a log of that so you can see those trends. But you can also weigh them like just once a day and stick with the same time of day so that you don't have that factor as much. Like I said, other things can affect weight. Um, and I think that monitoring weight can be a really helpful way of assessing reproductive status in females also. And that's because when the reproductive tract is active, so it looks like all those pictures I showed you, it is big and it weighs a few grams. When they're turned off, so to speak, so no reproductive stimulation, they're not thinking about sex, the reproductive tract shrinks down to its inactive size and it is tiny and weighs almost nothing. It's so small that it's not visible on imaging, and it basically weighs nothing. So using a cockatiel as an example, um, I have a lot of clients who are able to tell that they're amping up reproductively, not just from behavioral signals, but also from their weight, because the reproductive tract becomes active, it weighs a certain amount, and if they have an egg on board, that's going to weigh a few grams too. So you can get sudden weight changes related to like, oh, I'm about to lay an egg. So what we have to figure out in each individual bird is what is your lean body condition weight? What is your reproductively inactive weight? Let's say it's the dead of winter, not to say that it can't be horny during the winter because there's so many other factors that influence that. But let's say it's the dead of winter and they haven't been laying in the eggs and they're not exhibiting reproductive behaviors really. And my veterinarians told me that they're in good lean body condition, they're not overweight, and this is what their weight is. And basically knowing what their lean, maybe empty crop, first in the morning, reproductively inactive body weight. And once you know that, you can then assign meaning to weight gain. So let's say you know that their AM to PM trend is 10 grams based on what they're eating or things like that. But now you're seeing that their morning weight is up 5 grams, something like that. And evening weight too. So their overall weight is up that amount. Um, and sometimes you'll see a kind of a climbing trend from there. You might also notice during that time that there's reproductive activities being shown, and sometimes, being like crying out for food and things like that can be part of that because they're like, I need more calories, I want to make babies. And so it's at those times when you go, okay, I don't, your reproductive tract is turning on. I can tell by your behavior and I can tell by your weight. And I don't, if I can help it, want to go have that go to fruition and you to begin laying eggs. So that is when you go, okay, I'm going to start making things scarcer. I might upset your environment a little bit by, let's say, moving your cage to a different location or rearranging cage furniture or things like that. I'm going to go, I'm not going to starve you or anything, but let's say you've been eating half a spray of millet a day. We're going to cut that down way down. You get just a little bit of millet, maybe. So these higher calorie treat items, we're going to cut back on those. If you've, let's say, been eating unlimited pellets, I might go, oh, let's feed you a measured amount instead. And I'm going to get you busy. Mainly with foraging and going, if you're going to have this seed, you're going to have to pick it out of a foraging box or something like that. So what you're doing is you're like, I'm going to institute wintertime on you right now. I'm going to pull the rug out from under you, so to speak, and see if I can get it to trend back the other way and get your reproductive tract to shrink down and become inactive. And then you'll see along with that, the weight declines to go with it. So I have some clients who have really dialed it in and they have figured out what their bird's reproductively inactive weight, lean body condition weight is, and what the reproductively active, I'm about to lay an egg, heavier body weight is. And they use that as a barometer to help them decide how to make diet and environmental changes to control that. As far as them like calling for food and things like that, I mean, anytime, vocalizations are considered problematic, like they're kind of driving you crazy or they're screaming or things like that, um, you know, the consequence of that may be, oh, you go give them attention. Maybe that, they're like, oh, I'm gonna yell at you because I know that you're gonna come give me attention. Or maybe I'm gonna come give you food. It's important for us not to reinforce that particular behavior and instead to reinforce different behaviors like an acceptable sound or a period of quiet or things like that. Um, so, I mean, you can't totally, stop them going, hey, I want more food. I want more food. Even if they have plenty of food to meet their calorie needs, they may still demand more. Um, I try to kind of address that, I guess, from a behavioral standpoint rather than give into it and give them more food.
We have more diet related questions.
Mhm.
Um, let's see. This one here says pellets are supposed to be 50 to 70% of the bird's diet, but what are birds eating in the wild that is similar to pellets since pellets are human made? Is it regular oats?
Yeah, so the fact of the matter is that wild diets and captive diets don't have a lot of similarities at all. In the wild, in these various parts of the world these birds are from, they may be eating some grains, probably like the seeds of grasses and things, stuff like that, like for cockatiels. But again, it varies tremendously throughout the world and with different species, but they're eating types of fruits and leaves and flowers that we don't even have in the United States. Um, they're eating occasional insects, maybe that, we don't have here. So pellets, most of them, they do vary a little bit, but they're composed of various grains that can include like corn and soy, or soy being a legume, grains, legumes, um, um, things like, basically like things that are part of our diet that we have assimilated into making pellets, and even seeds are components of pellets as well. Um, so it isn't to say that the components of pellets are really very much at all, like what they would probably eat in the wild. But we use pellets also as a vehicle for vitamins and minerals, kind of in the same way that dog kibble. Okay. So dog kibble doesn't in any way, reflect what they eat in the wild, right? But it includes various components or that are similar to that, right? So like meats, proteins, some grains, and then we can add vitamins and minerals to the right nutritional profile of what they need and then package it all neatly into one little kibble. And then they're not able to parse it out, right? So instead of getting them a bowl of like, here's some grains, here's some meat, and here's a pile of vitamin powder, something like that. And they go, okay, well, I'm just going to eat the meat and walk away. Right. Or in the case of bird diet, like a seed mixture, I'm just going to eat this one type of seed or something like that. So pellets are meant to using mainly foods that are normal in humans and other animals, feeds, uh, added to which is added vitamins and minerals, the idea of making them uniform and nutritionally complete to the best of our knowledge, really. Um, but I really think they should only be one component of the diet because there isn't a one size fits all pellet for every species of bird. And like I said, none of them have ingredients that very closely align with what they'd be eating in the wild. Um, so we bring in veggies and fruits. We bring in some grains, maybe oat groats being part of that, seeds. But we have to kind of, you know, control the balance of those different things. Even the fruits and vegetables that we have available to us are not all that much like the ones that they are exposed to in the wild. They're highly genetically engineered for the most part. Like even a wild banana, okay, like a plantain is very different from the banana that you buy in the grocery store. Um, so if probably really want to get down to it, what you would want to do is research what is known, if anything, about the diet predilection of what specific items that they eat in the wild given the species and go, what is the most similar things that I can source in the United States to feed them? So, that would be kind of like, I guess, the ideal thing to do. But there's limited information as far as what absolutely the same a different species might be exposed to and eat in the wild. And there's limitations to what's available to us to align with that.
Yeah. It's really interesting. They've done some, or we have some papers that we looked at here, and they've seen parrots eating fine earthen materials and funguses and charcoal and things like that that would be almost impossible for us to replicate in a captive
Yeah,
environment.
or safely, right? Like who knows that, there's a mushroom or dirt that's not toxic or something.
Yeah, it
Yeah.
has some sort of bacteria and it's something
Yeah.
like that. So, yeah, it's really, there's of course so much more information coming out as people do more research about diet, but of course it's going to be very species specific too, because they're in completely different parts of the world. But to talk a little bit more about diet, we do have a webinar that is up where we have talked about diet much more extensively. And
Yep.
we also have other webinars coming up this year that will also cover diet in more detail. So while diet is a very major factor when it comes to some of these hormonal behaviors and pathology that we see with our parrots, we do discuss it in more depth in
Mhm.
some other areas as well. So
Yeah.
yes,
Yeah.
perfect. Let's see. I have one question here. They say, what effect does the papillomavirus have on the reproductive system? And this is something that we see a lot with a lot of our flock members being herpes positive. So, could you talk
Yeah.
a little bit about that?
Yeah, so papillomatosis or herpes-induced papilloma growths typically appear in just inside the vent opening. So the very entry into the cloaca, or what I like to call the foyer of the cloaca, and also the oral cavity as well. So like the roof of the mouth, the choana around the opening of the trachea, things like that. So in the context of reproduction, um, probably the effect would, you know, relate mostly to papillomas around the vent. I could imagine that, um, interfering with successful copulation. If you're trying to breed birds, where these growths get in the way of semen transfer, or things like that, or perhaps, it's painful to engage in those behaviors when I'm trying to lay an egg. Do I have more difficulty passing it because it has to push past growths at the vent opening? Um, so I think, it would be mainly those effects as far as reproduction. Also, birds that are, let's say, experiencing chronic pain, which sometimes papillomas can do that, tend to be less likely to be reproductively active because pain is kind of the ultimate anti-aphrodisiac, so to speak. So those are some ways I can think of in which papilloma might affect a bird reproductively.
And a follow-up question for that, is the herpes virus something that can be vertically transmitted from a hen to a chick?
Mhm. That's a good question. And I don't entirely trust my memory, but I'm pretty confident that it is not vertically transmitted. But I could be, don't quote me on that because I think that I could be incorrect, but I'm pretty certain that that's the case. I'm actually going to check really quick. I think it's only horizontal transmission. But let's see if I can determine that for you. Okay, so in reviewing that really quickly, it's mostly horizontal transmission. Technically, vertical transmission can occur, but it is not the main transmission route.
Mhm.
So it is, it's reported occasionally, but it's not a major issue.
Alrighty. I think we have time for maybe one more kind of conversation here. It wasn't a question, but I did see some discussion about it in the chat, and this was related to medication. Um,
Mhm.
the primary medications that you had mentioned were the Lupron and then the Deslorelin, which are what we most commonly use for our flock members here at TGF when it comes to
Mhm.
managing some of these hormonal behaviors. But then someone had mentioned that one of their birds was started on a medication, but they said, FYI, it's not Prozac or Haldo. I think they're referring to haloperidol,
Yeah.
as some veterinarians seem to use. Have you encountered any veterinarians that are using some of these, like Prozac, haloperidol, to manage hormonal behaviors? And could you comment a little bit about your thoughts around some of that?
Yeah. They don't tend to be utilized to address hormonal behaviors, really. Um, those drugs fall into a category that we call psychotropic drugs. So there's a lot of different types of psychotropic drugs. Haldol or haloperidol, same thing. For example, is an antipsychotic. It's an old antipsychotic, meaning it's one of the first ones developed in humans. It's not even like what they use these days for people. Um, Things like Prozac or and others like it are called SSRIs or selective serotonin reuptake inhibitors. We're familiar with them in people of addressing anxiety and depression, OCD, things like that. So psychotropic drugs are most frequently reached for in avian medicine to address self-injurious behaviors. So feather damaging behavior, feather destructive behavior, self-mutilation behavior. I mean, to be fair, I think that some veterinarians have used them for, maybe problems that people tend to ascribe to hormonal influences. So like aggression, biting, excessive screaming, things like that. I do not feel that that is a good application for psychotropic drugs. And as a matter of fact, there's not a lot of great applications for psychotropic drugs because they have generally been pretty unsuccessful or at least very hit or miss as far as actually helping birds with these, compulsive behaviors or self-destructive behaviors. Um, there are cases where I have found them to be helpful, but it's, like I said, very hit or miss. Most birds in which I've tried SSRIs, it has no effect. And the problem is that we don't have very much data to tell us what doses are appropriate, how often it should be given, whether it's even absorbed when given orally, things like that. They're very different from us. And even there's huge differences in the way drugs work in the body from one species to the next of birds as well. So even when we do have a study that says, oh, if you give them this dose, it reaches this certain level in the bloodstream for this many hours, or things like that. Even if you have a study like that for the drug, for a specific drug, it's only going to have been done in like one species of Amazon. And then you have to like extrapolate over. And we know very well that extrapolating drug doses between species of bird and even species of parrot is fraught with problems because they're so different. I mean, for the most part, we're forced to do it to a degree because we just don't have the information. But things like Haldol, for example, um, I and other colleagues have found that it can have value in some self-mutilating birds, and seemingly cockatoos being, the most common among them. But the problem is it has a fairly narrow safety window, meaning that there are some really severe, even fatal side effects at higher doses. And I think what's really going on in most birds that Haldol is used is they're just a zombie. So it just knocks them out. And so they're not chewing their feathers or they're not mutilating, but they're also not doing anything, right? They're just in a stupor. So they're not foraging, they're not playing, they may not be eating that well. So that's not something that I try to avoid its use actually quite a lot. And with SSRIs, I just haven't had very consistent results. Now, another area, and I think very recently there was a webinar on CBD because that's another area of interest where we're trying to learn more and more about that, but there's still just not a lot of information. So psychotropic drugs as a whole are very poorly figured out in birds. And I think their application, I think they're applied sometimes inappropriately or to no good effect. So I would not look at a bird that's going, okay, these problem behaviors as I perceive them are related to reproductive stimulation or activity. I'm going to throw a psychotropic at that. Probably not. I'm going to be going, what's the diet and lifestyle and interactions with flock members and humans, and basically approaching it a very different way.
Wonderful. Well, I think that was all of the questions and kind of comments that we had in our chat here. Julie, did you have any comments or anything that you wanted to throw in there before we finish up here?
Well, I think this has been just a really beneficial, rewarding webinar for all of us, talking about the basics, the things that we do have so much control over. And I really appreciate Dr. Brenna, including ways we can make our birds' worlds larger by giving them more to do, more activity. Rather than always looking for a drug to medicate or control behavior. I think it's so helpful. And I think that this is, again, one of those webinars where when I see something about this miracle of an egg that our pet birds or the eggs that we have for breakfast or our pet chickens or our farm animals it really is a miracle how this reproductive behavior and function have developed, and to have the ability to go in and do surgical or manual intervention to help with some of these occurring reproductive disease and problems. I think it is so, we are so grateful and so fortunate to be able to have, for us, a veterinarian that takes this kind of interest, but that also can really, really assess, even if by process of elimination, some of the situations that we face every day with the several hundred parents that we have in our care. And in turn, we get to share that information with our adopters and our audience. And that when we know more, we can do better. And I think that this webinar especially sets the precedence for that, because I believe that everyone who participated in this today and who will have a chance to share the message from our YouTube channel has nothing but great information to learn as a result, and give our birds the respect they're due, and again refocus that they depend upon us to maintain their mental, physical, and social health. And with the information that we've learned today, we have so much more insight each time we have a discussion like this in a presentation, that we get to pay it forward. So I thank our audience today for their excellent questions, for their posts on chat, but especially to Dr. Fitz and all of the veterinarians that we know, that we trust, and that are able to keep our birds healthy and to make the most of the lives that they have with us. So I have extreme thanks and gratitude to everyone for being here today on this very, very serious topic. I recently lost one of my own female cockatoos. Her name is Casper. She was 67 years old. I only had her for 30 years of her life, and working with Dr. Fitz to try and get Casper better, and then finding out what we didn't know. And so many of the pictures that I observed in this presentation today really helped me understand that even oftentimes with the best in care, we can still not notice everything, and that Casper really suffered from reproductive disease that she hid for such a long time until it was too late. Is eye-opening, and I, in spirit, dedicate this presentation to her. So thank you to everyone for making life better for the birds that count on us all to be there.
And then quick little note, quick little plug here. Anyone that is a Colorado local or a Denver local, Colorado Exotic Animal Hospital has changed names to the Exotic Pet Vets. So still Dr. Fitz and all of the same team there, but just going by a different name. So if you see any of the branding change or any of like the new logo on our upcoming webinars or anything like that, it is still everyone that we know and love. So there. Any other little plug, Brenna?
No, I think that's about it. Yeah, there was a rebranding that happened that we're concerned could cause a little bit of confusion. But yeah, I appreciate you pointing that out. But anyway, I just wanted to also acknowledge and thank everyone who supports the Gabriel Foundation and the incredible work that they do. for birds, not only with the care of their birds, even with very complex and severe conditions, but also the kinds of educational opportunities that they provide to the public, including these webinars. So I feel very honored to be a part of that, and thank everyone that supports in any way the foundation.
And speaking of educational, we do have another webinar that's coming up here pretty soon. On May 17th, which I believe is a Sunday, we will be hosting Dr. Travis Noto, also at Exotic Pet Vets, for his very first webinar with us. So if you guys haven't registered for that one, that is on our website. It is on our social media. So I would definitely recommend registering for that one. It's about common household hazards. As we're getting into warmer months here, we're seeing a lot of windows left open, doors left open, birds being found outside, and of course all of the other hazards that you can have in a household. So yeah, we're super excited to see Dr. Noto for the first time here virtually. All right, everybody. Well, I think if that's it, thank you guys so much for joining us today. Hope you learned something new and exciting, and hopefully we'll see you for our next webinar. All right. Thank you, everyone.
Thank you.